come out of the doctor's office having heard that you have cancer, a life-threatening illness. What do you do? Well, you could fall apart. Or, as I'm always advising people, ask yourself, WWLD, what would Lassie do? And I'm not trying to be frivolous, but yes, I don't mind being lighthearted, because animals and children don't worry about next year. When I thought one of our sons at age 7 had a malignant tumor of the bone in his leg, and that he would be dead in a year, this was many years ago, I tried to get across to our family that they should be appropriately depressed. We have 4 other children and my wife. And this 7-year-old came to me the next morning and said, "Dad, can I talk to you for a minute?" I said, "Yes, what is it?" He said, "You're handling this poorly. We want to go and have a nice day, and you want us depressed in our bedroom." So take it one day at a time. Remember, you have the potential. You're not a statistic. Statistics do not determine what happens to individuals. And there is survival behavior. There's something called an immune competent personality. Now, I know if you ask your doctor, what shall I do? How should I behave so I have the best chance of surviving? You'll probably get an answer, take your medicine. Say chemo, radiation, surgery, whatever. But there is also you and your life. If you love your life and you love your body, it gets a live message. Spontaneous remissions and miracles are mislabeled. They should be called self-induced healing. So if you've learned, yes, I would tell you to go get some of my books and other books that people have written about survival behavior. Okay? And then you find meaning in your life, you express your emotions, you ask for the help you need from family and friends, you say no to things you don't want to do, and rebirth yourself and reparent yourself if you weren't loved as a child. You find play, things that make you lose track of time, healthiest state you can be in. You make decisions about treatment. You use your feelings the way you use hunger. You seek nourishment. So if you don't like what you're going through, look for the nourishment in your life. And don't live a role. I don't want you alive because you're mama or the wage earner. I listen to people in the office say, "Oh, there's no point in living, I can't work anymore." That's the men. And women who say, "I can't die till all my kids are married and out of the house," and die when the last kid leaves home. So what would I say if you walk out of the office? Say, okay, what am I feeling? Listen to the words that come up, and any negative words, see what else in your life fits those words and eliminate them. And when the words become wake up call, give blessing, new beginning, then you know you're on the right track. And you can surprise your doctor too, and teach your doctor. Because if your doctor hasn't had a life-threatening illness, they're a tourist and you're the native.